Thank you very much, and thank you, Madam. Two thank yous. First of all, you very quickly instituted the hearing aid law that Senator Warren and I sponsored. I also want to thank you for enabling the transition health plans to continue, because 65,000 Iowans are benefiting from that action, and many of these people are farmers and small business owners. Letting them continue has been a bipartisan priority under President Obama, Trump, and now Biden. So I hope HHS allows them to continue in the future beyond 2024. Now let me go to my first question. Members of this committee, including this senator, investigating the deadly failures of our nation's organ donation system, the organ procurement and transplantation network. I've been looking into this network a long period of time. The problems have gotten worse. Thousands of patients are dying every year, and billions of taxpayers' dollars are wasted because of gross mismanagement. The system is rife with fraud, waste and abuse, corruption, and even criminality. This committee has received credible allegations regarding the United Network for Organ Sharing, relating that organization threatening whistleblowers, including even patients and caregivers. Simply put, this is beyond unacceptable. These efforts appear to be part of an attempt to cover up failures and prevent competition for its government contract. So, question to you, I hope that you can commit to fully investigating all instances of whistleblower retaliation and harassment. Would the HHS commit to removing anyone involved in that improper conduct from any involvement in the organ procurement and transplantation network leadership and committees? And if you don't agree with me, why not?
Senator Grassley, first, thank you for the work that you've done. As you mentioned, this has taken a long time, and thank God that you've committed to it. On the whistleblower question, we are absolutely committed to working with you to make sure that if there is a claim made about a particular operation, we dive right into it to find out what's going on. But let me give you the more important news. Today, we are announcing at HHS that we are going to put forward a modernization initiative, which will do a number of things that I think you're going to like. One, we're going to call for competition in who becomes the contractor for these organ procurement and the transplant services. And so it will no longer be just one company that the way it's been for, 40 years. So that's one big change that will occur. Secondly, we're going to require transparency. They got to start sharing their data. They can't hide, as you just said, behind this confidentiality and say, we can't show you what's gone on because it's confidential. We're going to require far more data transparency. Again, this follows all the work that you've done. And then finally, we're going to try to upgrade the IT system, which, as you can imagine, with these contractors never having changed, everything gets stale. So does the IT. We're going to try to update the IT so we can be efficient with those organs that we receive, so we can get them to someone instead of have them ultimately be discarded because they didn't get used in time. Those are things we're announcing today. And in the president's budget, he calls for resources so we can implement this. So we're absolutely going to call on you for your help to try to move this forward, get your input. But again, much of what we're announcing today is a result of the work that you've done over the years.
Thank you for your initiative. I want to turn to rural health care. I want to thank the administration for implementing the new and voluntary rural emergency hospital program that I've worked for 3 or 4 years to get passed. Another rural hospital program that you may not know so much about is called the Rural Community Hospital Demonstration. It extends the financial viability of 26 small rural hospitals in 11 different states, 5 in Iowa. The program has taken up to 30 hospitals, but CMS is currently underutilizing the program. Congress has authorized the program for several more years. While there is interest in rural hospital participating, CMS has told me that they have no interest in filling the 4 additional slots. I realize that you may not know much about this program. Do you think that we should be underutilizing cost-effective rural hospital programs like the Rural Community Hospital Demonstration? That's
Senator, I am familiar with the program, and we are making a concerted effort in rural America to inject some life into some of these facilities because, as you know very well, too many of them are closing, and they're not being replaced. And when they are being replaced, they're first being gutted of some of the essential services that they used to provide. So we have dedicated services into rural community hospitals, but we're going to try to do more. And we certainly will take your lead on some of these initiatives because we know that those of you who go back home every day and have to deal with those providers know exactly what they need and where they need to go. So we'll look forward to working with you.
Mr. Secretary, thank you, Mr. Chair.
While he's in the room, let me thank Senator Grassley for working in such a bipartisan way over the years to improve this system with respect to organs and organ procurement. Yesterday, there was, in my view, a big victory for families across the country who've been fighting for a more effective organ procurement and transportation system. The administration indicated they work with us to have more competition in this UNOS contract. This committee has felt on a bipartisan basis that there hasn't been enough competition for the contract and meeting the expectations of Americans waiting for a transplant. So I want to thank my colleagues on both sides of the aisle. Senator Grassley in particular has been at this for years and look forward to working closely with him.